Welcome to the Mothership Show, a new podcast where we break down the week's biggest topics. Recently, foreign worker dormitories in Singapore have been in the spotlight. The number of foreign workers infected with COVID-19 has been rapidly increasing in the past week, and foreign workers in dorms alone make up about 80% of all 11,178 cases in Singapore. This is of course worrying because cases in dormitories only started appearing in early April. The S11 dormitory at Punggol, which was one of the first few foreign worker clusters, now has over 2,000 confirmed cases. These numbers are accurate as of 24th April, as the numbers are updated daily and may change depending on when you listen to this. As the number of infected in foreign worker dormitories rise, worrying sentiments and xenophobic remarks have surfaced. In particular, a forum letter speculating that the outbreak in dorms is due to foreign workers' personal hygiene and living habits has been widely debated. In response, Home Affairs and Law Minister K. Shanmugam has called the letter racist and deeply insensitive. Today, I speak with Dipa from Itsrainingraincoats, a local initiative who aims to bring awareness and recognition to foreign workers. Dipa herself is someone who has worked very closely with these workers, as you hear later on, and we talk about how the cases might have spread so quickly and what Singapore as a society can learn from this, which is extremely pertinent in today's situation. Hello Dipa, could you introduce yourself?
Okay, I'm Dipa Swaminathan, the founder of Itsrainingraincoats.
Thank you for being here with us. So, how have you been coping with working from home so far?
Well, it's okay. I mean, I'm wondering how I'm going to adjust back to the going to the office every day situation. It's like gotten so used to this.
Yeah, it's taking me a long while to get used to this as well. So, firstly, how do you think the virus spread so quickly within the foreign worker dormitories?
Well, I guess if given the conditions in which they live and work, and given that those conditions are so crowded, to some extent, perhaps it was inevitable. They were not, for example, right at the outset provided a mask, reusable masks or hand sanitizers, to prevent the spread among themselves. And as we know, there are dormitories where there are like 15,000, 16,000 men in one sort of building. They are transported in lorries where they sit, packed close together. They work in construction sites where, again, they're really close together. So if the outbreak entered their community, then the fact that it would spread rapidly, was inevitable. I mean, it's just the biological, it's just the biological trait of the virus. It goes from human to human when you're in close contact. These people are in close contact with one another all the time. They don't have an option. Social distancing is a luxury that they don't have.
I see. Yeah. I was especially surprised when comparing with the previous, or rather the first outbreak from a work pass holder in a dormitory, which was in February. I think the first one was the Seletar Aerospace Heights. I think it was case 42. And I think he stayed at the Leo dormitory in Kaki Bukit. Why do you think the clusters have emerged now rather than in February?
But I think the fact that they've emerged only now is a testament to the hygiene of these men. I mean, I've been reading some reports that because they're not hygienic, this is I've never heard anything quite so ridiculous. But I think the fact that it's taken all this time for this outbreak to finally enter their community is actually a testament to their hygiene and their hardiness. It's been in Singapore since since early Feb. COVID cases have been in Singapore. Singapore, I think, has a total population of 5 over million. And these guys are close to 1 million. So they're 1/5 of our population. So it's not unusual that that one or a few of them would catch the virus from wherever it is that they caught it. But as I say, once they caught it, then the fact that they spread it among themselves, to some extent is inevitable. I mean, there are super carriers and others. So some cases it may not have spread. In some cases it did spread. It's hard to know the exact passage of the virus.
Right. Okay. So, what do you think are some of these factors that, you mentioned before the close living. What are some factors that may have worsened the spread within these dormitories? Could you list them out?
Well, I mean, I don't know if you've seen photos of a dormitory, but it's basically, about 30, sometimes 40 people, living in one space. It's these bunk beds, right? I mean,
Yeah.
if you're sleeping in multiple bunk beds, and somebody sneezes from the top or whatever, and then you're sharing toilets. Several of them share one toilet. And then you even the gantry to enter the dormitories, that's a touch point. Everybody has to enter the dormitory through a gantry. That's already a touch point right there. The lorries that they climb into and climb out of, even if you enforce social distancing, just the very fact that they have to hold the railing to jump into the lorry and jump out, that's another touch point. I mean, in a day, there are probably 1,000 touch points where they interact with one another. So it's not rocket science, I think. I mean, anybody who's seen photos of the dormitory living conditions would know that it's almost impossible for them to completely stay apart from one another.
Right now, I think the Minister Josephine Teo, she announced that most, if not all, of the dormitories are technically on lockdown. Do you think these measures are a good way to contain the spread among foreign workers?
Yeah, I think to be fair, the government is doing everything that they can do to contain the spread of the virus. It's a massive problem, and it's not one that has a magic solution. So I think, yes, separating out the healthy workers, checking them to make sure who is healthy and who is not, and also within larger dormitories, trying to uh, perhaps segregate them into smaller groups. I think all of these will help to contain the virus.
Okay. So, what are some challenges you think in terms of containing the virus?
Well, we're hearing some reports. I mean, we have no way of verifying this, but we're hearing some reports that in some dormitories, the cleaners, the dorm operators, they're all scared. So the dormitories are kind of, left to themselves. They're still, we're still getting some photos of, dormitories, the toilets that are not cleaned, etc. So I think, probably stepping up inspections, stepping up checks on all migrant worker lodging areas. And those are not just dormitories. There are construction sites where migrant workers are lodged. There are, rooms where migrant workers are lodged, which may or may not be legal, but that's a different issue. Migrant workers are lodged in all kinds of living arrangements. So I think stepping up enforcement, stepping up checks, really being aggressive and calling out dorm operators for not doing what they do, because it's a lucrative business. Running a dorm is a lucrative business. They make money doing this in good years. This is the time when they need to also, do their duty. It's one thing to have a lucrative business, but this is the time when the dorm operators need to do their duty for not just the workers, but for the whole country in doing what they need to do to ensure that dormitories are clean, the inhabitants, the residents of the dormitories are provided for. These are human beings, they're not just numbers, they're not just statistics, they're not just tools in a trade, they're human beings. They suffer isolation, they suffer fever, they suffer body aches, and they suffer depression and anxiety just as much as you or me. So I think a humane perspective and a stringent, enforcement and inspection regime with penalties, not, for the dorm operators, I think will go a long way.
After this outbreak is over, how do you think not only the dorm operators but average Singaporeans will view foreign workers?
Well, I hope, I think as a community, we should be mindful that a virus like this could strike again. That's what I hope we all remember, is that, when we come out of this, and we don't even know now when that will be, it's entirely possible another virus is waiting in the wings. We should remember that that possibility is always there. This virus came out of nowhere, but just as easily another one could. So we need to be mindful that these kinds of unexpected sort of calamities can happen at any time. And our strength as a community is comes from how we support one another and how we keep each other safe, because in doing that, we protect all of us. Like, take the example of the migrant workers. If one migrant worker was protected because he had a mask or because he had a sanitizer and he doesn't fall sick, the benefits are not just for that migrant worker, it's for many people around him. It protects many others around him from falling sick. If all of them fell sick, it would be a burden on the healthcare system. So if this worker didn't fall sick, it would benefit himself, it would benefit his mates, it would benefit the healthcare workers, it would benefit his company because they don't then need to quarantine him. It would then benefit the economy, and that would then benefit all of us. So the safety of one is the safety of all. And we need to remember that. This is not us against them or one against the other. In these types of calamities, the safety of one is the safety of all.
Agreed. So, what do you think Singaporeans can do to help the foreign workers?
Well, there are many ways. If they want to get more involved, there are groups like ours. It's Raining Raincoats. We're running a number of initiatives. There are other groups as well that are doing, great work on the ground. And more importantly, on a fundamental level, I hope that Singaporeans will understand the plight, of these men, and empathize with them and not accuse them. We don't see them accusing anybody that this virus has befallen them, but they work on fairly low wages and they do hard physical labor that you or I wouldn't be willing to do. You wouldn't be willing to be the one to lay the last brick on Marina Bay Sands, standing at such a great height on just scaffolding. Digging, tarring our roads on a day when the heat is so much that you can't even walk outside your gate for 10 minutes, or pruning a 30-foot tree, when the branches and leaves are falling off. I mean, this is all hard labor. They wake up very early in the morning. They go to work not in an air-conditioned bus, but in a lorry exposed to the elements. They do their hard labor, then they come back home. And a lot of times we're seeing a lot of photos of dormitories. Do you know that a lot of them don't even have mattresses? They just sleep on wooden planks or on metal beds. That is their day. It's not like they can come home and say, okay, I'm going to sink into my bed, get a cold beer, watch some TV, have a hot shower. There isn't even that to look forward to at the end of a day, right? So this is their life, day in and day out, week in and week out, month in and month out, year in and year out. So let us show them some sympathy and gratitude, if nothing else. Be a little gracious, right? If you want them to be classy, then we have to be classy in how we perceive them and in how we treat them.
Okay, that's another of your very nice quotes. Okay, last question. I assume you've been in contact with a few of these foreign workers. How are they now? Like, are they very worried, for example?
Well, what I've realized after working with these guys for so many years is, they're very positive, they're very resilient. There's not a lot that gets them down. For example, yesterday, MOM wanted to film a small video with me. So, in my condo, I'd had people drop outside my door, some games, some 3-in-1 coffee, and a few other treats for them. So there's a little a work site that is near my place. So with the MOM crew, we drove there, and I took everything out of my car. The worker came out. Everything was at safe distance. We were all wearing masks. But I was chatting with this guy, right? And I said, "How are you doing?" So in there, where they're put up, there are only like about 30 workers, but one of them had COVID. And he said that, the MOH came and took him away, and the people that was a Chinese worker, and those close to him are, within, they're serving their stay home notice in one room. All the other workers are in the other room. But he was smiling, and, he was so grateful that I'd taken all these things to him. And they call me Akka, which is the word for sister. So he was like, Akka, we are fine. So they're very positive, and they're very, resilient. I mean, I have something to learn from them. I mean, if I were in their position, I don't know what I would do, but they show so much grace under pressure.
That's right. I think after hearing what you said, I myself have a lot to learn from these foreign workers as well. Yeah. Right. Anyway, thank you so much for coming on the show and sharing your insights and your experience working with the foreign workers. Personally, for me, it has helped to put a lot of things into perspective. And I think same for the listeners. So thank you so much. For those listening, do let us know what topics you'd like us to cover next week. And also get in touch with us if you have any feedback on the show. See you.